Namaste and good afternoon. Welcome to our Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaran here and happy to see you all again. Today we are discussing an important topic, cancer of the liver. As you all know, cancer is a condition where cells in a specific part of the body grow and reproduce uncontrollably. The cancerous cells can then invade and destroy the surrounding tissues as well. The liver is a very important and essential organ, about the size of a football, which sits in the upper right portion of your abdomen, just below the diaphragm and above your stomach. The liver is a very essential organ performing hundreds of functions necessary to sustain life. It's also a gland that secretes several proteins, hormones that other parts of the body need. The liver can be affected by many conditions like viruses, genetic disease, alcohol abuse, obesity, and one such important condition is liver cancer. Liver cancer is cancer that begins in the cells of the liver. The most common type is from the main type of liver cell, which is the hepatocyte, but there are other types of liver cancers as well. And one other important type of cancer is cancer that spreads to the liver rather than the primary liver cancers. So this is called metastatic cancer. Today we are going to discuss about liver cancer in detail and also focus on what the latest modalities of treatment are that can help overcome this cancer. So to discuss this topic in detail, I am delighted to welcome Dr. Anand Ramamurthy to this discussion. Dr. Anand Ramamurthy is a surgical gastroenterologist with over 15 years of experience. He has several degrees, the DNB in surgical gastroenterology from the Sri Gangaram Hospital, MRCS Edinburgh from the Royal College of Surgeons of Edinburgh, DNB General Surgery, National Board of Examinations, Delhi, MS General Surgery from the Maulana Azad Medical College, and he also did his MBBS from the same institution. He has been a senior consultant, adjunct professor at Apollo Hospitals and AHERF from 2008 to 2022, and has also been a senior consultant and head of the Department of Surgical Gastroenterology and Liver Transplantation at the Hindu Mission Hospital, Tambaram, Chennai, senior clinical fellow liver transplantation at the Gangaram Hospital, Delhi, and King's College Hospital, London. He's been certified as a senior clinical fellow liver transplant, Gangaram Hospital, clinical attachment, liver transplant and hepatobiliary surgery, King's College Hospital, London, robotic surgery certification from the US, microvascular surgical skill course at the Ethicon Institute of Surgical Education, Mumbai. Dr. Anand has been part of several organizations, member of the Liver Transplant Society of India, founder member and former executive committee member. He's also International Hepatobiliary Pancreatic Surgery Association member, also member of the Indian Society of Organ Transplantation, and has helped to establish liver transplant programs in 11 centers across 6 states in India and 1 overseas. And this was an extremely busy and successful program, became the 4th program in the country to reach 1,000 liver transplants in 2019, and the largest deceased donor liver transplant program in India, and has also been teaching and training extensively the next generation of surgeons. He's been a thesis guide as well for 8 batches and mentor for PhD thesis for several medical students. Welcome, Dr. Anand Ramamurthy, to this discussion today. Thank you so much for joining us. So let's begin by asking you, what is liver cancer and how does it all begin and what are the different types?
Thank you for the kind introduction, Dr. Srinidhi. So, as you already pointed out in your initial introduction, liver cancer can be broadly of 2 types. One is cancer that starts in the liver, and second is cancer that starts in another organ but then spreads through the liver through the bloodstream. So the first type is called primary liver cancer, and based upon the cell that it originates from, it is either hepatocellular cancer, which originates from the hepatocyte, or cholangiocarcinoma, which originates from the bile duct epithelial cells. Whereas any abdominal or extra-abdominal organ cancers can spread to the liver, The commonest or recognized one is colorectal liver metastasis, that is disease, cancer in the colon, rectum, or intestine spreading to the liver. And but anything from breast to thyroid to bone cancer can spread to the liver, and this is called a secondary or a metastatic cancer.
So, what are the earliest and what are the other symptoms of liver cancer that one should be aware of?
Fortunately, liver cancer, like all other cancers, tend to be asymptomatic or do not produce any symptoms until they are pretty advanced in their course. During the when the bulk of cancer in the liver becomes very high, then it can cause loss of appetite, loss of weight, which is called cachexia, malignant cachexia, and a sort of dragging weight because of the bulk of tumor in the liver. Sometimes tumors can press upon the bile duct and cause obstruction to the flow of bile through them and result in jaundice. And such cancers may fortunately present early, allowing us a chance to kind of offer the patient curative treatments.
So let's talk a little bit about the causes of liver cancer. Are there any risk factors and who is at risk for developing liver cancer?
So, one of the biggest and most well recognized risk factors for liver cancer is liver cirrhosis. So, a patient with liver cirrhosis of any cause is 100 times more likely to develop liver cancer than patients with a normal liver. Among the patients without cirrhosis, people who have viral hepatitis, for instance, is viral hepatitis B and C. These are known to be tumorigenic virus and cause cancer. Then toxins like especially a social evil like alcohol can result in alcoholic hepatitis and cause cancer. And the new and emerging baby on the block is non-alcoholic fatty liver disease, or non-alcoholic steatosis as it is called, which can cause a state of chronic inflammation in the liver and then lead on to cancer over the long term. Apart from that, there are certain uncommon reasons like parasites, which cause chronic inflammation and over a period of time lead to chronic irritation and thereby cancer. So these are more or less the common ones that we encounter in regular practice.
So, are there any preventable factors in this as far as the risk factors? I mean, as in alcohol and in management of obesity and so on? Something that people can make changes to their lifestyle? Is there some preventable aspect?
Absolutely. A lot of these cancers, as the process is that the life cycle is that the inflammation goes on for several years and before developing into a cancer, and that allows us an opportunity to intervene and prevent. For example, if a patient has viral hepatitis, if the treatment, there are very effective medicines available to treat viral hepatitis, and the treatment results in complete elimination of the virus from the circulation and reduces the risk of cancer to normal. Similarly, toxins like alcohol, for instance, if they are stopped, then the disease can be will stop at the stage to which it has reached, provided it has not yet reached an irreversible stage. It can be stopped at that level. Coming to lifestyle diseases, like nowadays we are encountering a lot of patients who get general health checkup or screening done for as a screening, and then they are found with fatty liver. And sometimes fatty liver is the first stage. So sometimes what happens is that the breakdown products of the fat in the liver lead on to a free fatty acids, which lead on to inflammation in the liver, which is the second stage, which is called steatohepatitis. And if unchecked or if untreated, then it can progress on and eventually form cancers of the liver, along with cirrhosis, which may lead liver transplantation. So, adopting a healthy lifestyle by, when a fatty liver is detected on a health screen, health checkup, then the patient can, adopt a healthier lifestyle by watching their diet, by following regular exercise. And if they bring their weight under control, just like, the fat proportion in the body comes down, the fat proportion in the liver would also come down, and the risk levels of cancer would reduce. So as you said, it is a very preventable condition before it actually becomes cancer. And there is a long window available to do that.
Right. So, what would be the stages of liver cancer? What would be the way in which it is classified as stage one, two, three, and so
Well, basically, liver cancer is different from other cancers in that the staging that applies to all other cancers does not. And it's very technical. So, what is important for understanding is that liver cancer that is confined to the liver alone versus liver cancer that is involving either the major blood vessels or has spread outside of the liver, either to the adjacent organs or to distant areas, which is called metastatic cancer, which is commonly known as stage 4 cancer. So most of the liver, because the liver actually is an organ that has about a 70% functional reserve capacity, even if we remove about 70 to 75% of the liver, the patient can still have a normal liver function, and the liver, remaining liver will regenerate to its normal size. About 90% of it would be complete in 2 months, and then nearly 100% at a year. So another thing, as we were discussing earlier, is that not only is the cancer and the location of the cancer in the liver important, but also because cirrhosis leads to a very high risk of cancer, the underlying liver disease also limits the kind of treatment that can be offered to a patient with liver cancer. So, for instance, for a patient with a normal underlying liver, we can remove about 70-75% of the liver and cure their cancer if it can be done so. But for a patient with cirrhosis, we may not be able to remove the underlying liver because the liver is already damaged and diseased. So, in that case, we may need to offer alternative treatments like non-surgical treatments like liver transplantation, or treatments like ablation where they burn the tumor and a surrounding area of liver tissue, and or transarterial superselective embolization to deliver chemotherapy to the tumor alone and spare the remaining liver, and so on.
on. Where does the liver cancers normally spread? Do they spread to distant organs? What is the normal spread through the blood or? uh,
So it depends upon the type of cancer again. In primary liver cancer, for example, a hepatocellular cancer, one of the first organs to be involved would be the blood vessels which are going into the portal vein or the hepatic veins, the blood vessels that are going out of the tumor. Apart from that, the first site of distant metastasis, that is the distant spread from the liver, is lungs, and then followed by any other organ in the body, bone, and anywhere else in the body essentially. Cholangiocarcinoma, the type of cancer that arises from the bile ducts lining cells, it has a different pattern of spread. It is much more aggressive at presentation, and it's usually more metastatic at presentation, and is also associated with a poorer outcome on in the long term. It involves lymph nodes very easily and also spreads to multiple sites across the body. Based upon the third type, the metastasis, that is, it is already originating in an external organ and then spreading to the liver through the bloodstream. And as such, it has access through the bloodstream to most parts of the body. So it can manifest anywhere as it gets more advanced.
So, what are the principal diagnostic methods for liver cancer?
So the initial screening modality would usually be an ultrasound scan, and that is a general the first method that is done on to detect any liver kind of pathology or a liver nodule. If there is a suspicious nodule on the ultrasound, then a subsequent contrast enhanced axial imaging modality has to be used. This is usually a triphasic or a four-phase contrast enhanced CT scan or an MRI. So these are the primary two modalities that are used to, and they are almost very accurate in diagnosing any liver cancer which is more than 2 centimeters in size. If it is less than 2 centimeters, then we may face some diagnostic dilemma, in which case we may have to use other modalities such as a contrast enhanced ultrasound or a biopsy in some cases. But in general, in a patient with liver cancer, a CT or good quality CT or an MRI will be able to provide the diagnosis in almost all the cases above 2 centimeters.
At what point is a liver biopsy needed?
So the with the increased resolution and increased precision of these imaging modalities in today's day and time, um, a biopsy is rarely indicated. A biopsy, for example, would be indicated in a patient in which a CT and an MRI done consecutively are not able to determine whether the lesion is a cancerous lesion or not, or it may be done in cases where there is an unusual presentation. So, a patient with liver cancer with normal tumor markers in the blood and who has the findings on the CT and MRI are not equivocal. So, in those cases, we may do it. So, it would form a very small percentage of cases which would actually end up needing a biopsy. With a good quality CT and MRI, we can not only diagnose but also plan the treatment for most of these cases. Apart from that, we have blood tests such as liver tumor markers, which are used, which are increased in the liver. For example, hepatocellular cancer would produce something called alpha fetoprotein, which is like can be diagnosed by measuring it in its levels in a blood sample. Again, CA 19-9 is another such marker, and these would be able to tell us in conjunction with a CT and MRI whether the patient has a liver cancer or is it a non-cancerous benign tumor or a lesion of some other etiology.
Right. So, what would be the treatment modalities for liver cancer?
Well, the intent is always cure. So, if a patient presents with liver cancer, a patient with a non-cirrhotic liver, then surgery would be a treatment of choice because it is the modality that gives the best long-term, medium and long-term cancer, cancer-free survival, as it is called. But as we discussed before, the underlying liver condition has a big role to play in both the development of cancer as well as the treatment that can be offered to these patients. So, if a patient has cirrhosis along with liver cancer and we are not able to offer them a surgical resection, then we would offer them liver transplantation. Liver transplantation is a procedure in which the damaged cirrhotic liver along with the liver cancer is completely removed and is replaced by a healthy liver from a donor, either a part of a liver from a living related donor or a cadaveric or a deceased donor where a brain dead person donates their organs for transplant. So this is the other major modality that is used as a curative treatment for cancer. If patients are not suitable for these curative options, there are other modalities that are used. For example, one of them is ablation. Ablation is basically where a probe is placed into the liver around in the area of cancer, and by using heat, either by radio frequency ablation or by microwave ablation, where the tumor and the surrounding rim of normal tissue can be completely removed or burnt out, as it is called, and that leads to cure of the tumor. In the short term, this is provides similar outcomes. Up to 3 years, it provides similar outcomes to resection. But beyond 3 years, 5 years, and above, surgical resection, if possible, is the best. It can also be offered to patients who are not suitable candidates for surgery, either because of underlying heart disease or some other disease condition that makes it very risky for them to undergo surgery or transplantation. Apart from this, one of the new emerging modalities for liver cancer is the transarterial chemoembolization or radioembolization. So, in this therapy, an interventional radiologist goes through a blood vessel either in the groin or in the hand, and they reach the liver through super selective catheters. They reach the blood vessel exactly supplying the tumor, and they use that to deliver particles, either glass beads or coated with chemo agents like doxorubicin, or by beads or agents which are coated with beta emitting radioisotopes like yttrium 90. And these are delivered in close proximity to the liver. The advantage is that these treatments release the chemotherapy or the radiation therapy in very close proximity to the tumor and do not have any kind of side effects for the body of the patient. Like, they do not enter the general bloodstream of the patient, and they do not cause any of the side effects that are conventionally associated with chemotherapy or radiotherapy.
Um, so, is there a role for newer modalities of radiation also for liver cancers? We have proton and other such modalities.
Absolutely. So, apart from these therapies, now the main problem with radiation earlier was that the damage that is produced to the collateral damage that is produced to the area of the liver surrounding the tumor. So if the liver is already kind of damaged, then it would also cause more damage to the surrounding liver as well. So with the availability of these super selective and conformal radiation or stereotactic radiation, what we can do is deliver large amounts of therapeutic doses of radiation to the tumor bearing portion of the liver without much radiation affecting the surrounding liver parenchyma. And that has enabled us to get away without side effects in patients who require or who are candidates for radiotherapy. Coming to liver cancers, selectively, I mean, we are having a emerging data that in cases where the liver cancer spreads to the portal vein and causes thrombosis or blockage of the portal vein, combination of treatment modalities like ablation or transarterial chemoembolization, along with stereotactic radiotherapy or proton beam therapy to the portal vein tumor thrombus, actually results in resolution of the tumor from that thrombus and enables us to offer them curative treatments like liver transplantation or resection to give them a chance at a normal quality of life.
So, what would your final words be to viewers on what they must do regarding liver cancer, early warning signs, or screening, and of course the lifestyle aspects we've already discussed. So, any words on how one can protect themselves from liver cancer?
So, one of a couple of things apart from this, what we'd like to suggest is that patients who undergo a health checkup and they are finding a fatty liver or altered liver function tests, please do not ignore them. Go ahead, consult a medical gastroenterologist or a medical hepatologist and get it further evaluated. If whatever cause is found for that, whether it's viral hepatitis or whether it's lifestyle diseases, all of them are eminently treatable and also preventable. Prevention, I mean, is like worth way more than treatment. So if they can make these changes like good control of diabetes, treatment of hypothyroidism, treatment of viral hepatitis, adoption of these lifestyle changes, then they can continue to lead a healthy life. However, if a liver lesion were to be detected, there is no need to panic. We have very effective treatments available. Surgery for the liver was something that was really feared in earlier times. And now we have reached a position where we are offering liver resection surgery at near zero mortality risk. I mean, near zero risk to life. So if they do have a lesion detected, again, please consult a specialist medical opinion. And there is effective curative treatment that can be offered. If a surgical resection cannot be offered, a liver transplant can be offered. If a liver transplant cannot be offered, then we have, again, ablation, transarterial procedures, and a number of effective treatments that can be offered that can not only prolong the duration of life, but also give an excellent quality of life. So this is very encouraging news with regards to liver diseases and liver cancer more specifically. So this is the message that I would like to leave the audience with.
So, thank you so much, Dr. Anand, for this very illuminating discussion. So, viewers, I do hope that you found this session useful. So, the key message is that the liver is an important organ. It has many important functions playing a crucial role in so many processes in the body. But the liver can do its job best when we take care of it with healthy lifestyle choices. So, as doctor said, do take care of your liver, do screen yourself every year, and do catch any of the early warning signs on time so that any liver disease can be overcome and we can make sure that it doesn't progress and evolve into cancer. So, take care of your liver so that it takes care of you all your life. You can always contact us on any of our social media channels. Do keep following us on YouTube and Facebook to catch more of these health awareness videos. And you know that we are always available 24/7 to assist you through our hospitals, through our app, and through all our digital channels. So do contact us for any assistance, for any guidance. Meanwhile, take care and be safe. Thank you. Namaste.